Anyway, I interviewed Senator Mark Kelly just a little while ago, and we wanted to share that interview with you, and then we're going to get right into the talk. By the way, real quick, poll question. Let's watch those numbers move around. Which side should give in to help end this whole thing anyway? But let's talk to Senator Kelly about all this as well. Senator Mark Kelly joins us from his office in Washington. Senator, I know you believe you're fighting the good fight on Obamacare subsidies, but why not vote to keep the government funded, end the shutdown, and then take up the fight on these subsidies?
Well, we can do all of that and fix these subsidies today. It's pretty easy. And if you think my Republican colleagues, want to fix this for the American people right now, they do not. They have prioritized the tax cut for the richest Americans over the health care costs of hardworking people in Arizona. And the evidence of that is they just basically have refused to negotiate this. When the President of the United States over the last month has spent a grand total of 1 hour talking to Democrats in Congress about this issue, that's all the evidence you need that they do not want to fix this. They want those tax cuts to stay in place and higher premiums kick in here on January 1st, essentially, though people are going to start getting letters in the mail. They're already getting them. And when they go on the website to sign up for health care on November 1st, folks in Arizona are going to see much higher premiums. It's going to cost the average Arizonan $475 a month more. And for some individuals, they'll see their premiums double.
So, but Senator, isn't this proof that once you have funded a benefit, it's almost impossible to remove it? I mean, even if it adds to the debt, these subsidies went into effect during COVID, but COVID is over, and yet the subsidies can't be gradually reduced?
Healthcare is unaffordable for so many people across the country. And in Arizona, if there is no fix to this, the estimate is 109,000 people are not going to be able to afford their health insurance. And when that happens, and I think you probably understand this, people just drop their health insurance. And then if somebody in their family gets sick or injured, they wind up in bankruptcy. We are trying to prevent this for the 109,000 people that will lose their health insurance. But we're also trying to prevent, the other folks who are then they're going to try to figure out, okay, do I not pay the utility bill this month? Or maybe I have to sell my car to afford health insurance? My Republican colleagues and this president prioritized a big tax cut for billionaires over everyday Americans. And it's pretty simple. That's what this is all about.
So do you, I want to know where you have to get to in order to, get to yes, which obviously you and many of your colleagues right now are a no. Does a change or a tweak of the tax cut, does that have to be part of this deal for you?
You mean the tax cut for the billionaires?
The one you've been talking about.
No, we're trying to get them to fix the premium issue.
Okay.
I realize that cutting taxes for billionaires is such a huge priority for Republicans in the House and the Senate and this president. That is their number one thing. Give a tax cut to the richest Americans. We get that. I do not expect them, to backpedal and fix that. I hope in future administrations we can have a fair tax system where the wealthier pay more and hardworking people, get to pay less. But right now, what this fight is they're raising the premiums on hardworking Arizonans. That's the part of this we're trying. That's the part of this we're trying to fix.
All right. So let's get to brass tacks on that part of it. There's some focus this morning on a good friend of yours, Senator Jeanne Shaheen of New Hampshire, somebody who could possibly bring the two sides together. And I know in the past you've worked with both sides of the aisle. How much movement specifically would you have to see from the president to get your vote and the necessary votes? Or is it all or nothing? They have to be 100% restored.
Well, first of all, the president needs to sit down and try to understand what this is about. When they had the meeting, earlier in the week between Hakeem Jeffries, Chuck Schumer, Mike Johnson, and John Thune, and the president didn't even understand the details of these premium increases and how these tax credits work. So the first step, he needs to sit down with a brief, with a piece of paper, sit down and understand what this is about. And then he's got to get back in the room. They spent a grand total of an hour. And I know that, the Democrats in the Senate and the House are willing to talk to him about this. We're willing to talk to our Republican colleagues. We are trying. But the president needs to first understand what we were talking about here and then negotiate on this. And I think we could then come to a compromise.
Senator Mark Kelly, thanks for your time. You're always welcome here on Fox 10 Talks.
All right. Thank you.